before hospitals, before pharmacies, before colonial rule. Africa already had medicine. For thousands of years, Africans studied the human body, nature, plants, and the spirit. Healing was not guesswork, it was knowledge, tested, practiced, and passed down through generations. African medicine was deep, it was organized, and it worked. Today, we explore African medicine before colonialism, what it was, how it worked, and why it still matters. Herbal medicine was the backbone of African healthcare. African healers knew thousands of plants, what they cured, how much to use, and how to prepare them. Neem leaves were used to treat malaria, fever, and infections. Bitter leaf helped digestion and blood cleansing. Aloe vera healed wounds and skin problems. Baobab boosted immunity and strength. Moringa provided vitamins and energy. Herbs were not mixed randomly. They were measured, tested, and combined carefully. Roots were dried. Leaves were crushed. Seeds were boiled. The mortar and pestle you see was not decoration. It was medical equipment. Many modern drugs today are based on these same African plants. Traditional healers were the doctors of their communities. They diagnosed illness by observing symptoms, asking questions, checking pulse, skin, eyes, and behavior. Some healers specialized in herbs, others in bones and wounds, others in childbirth or mental health. They followed rules, ethics, and training. Apprentices studied for years before practicing. These were professionals, respected and trusted. Many people don't know this, but Africans practiced surgery. Archaeologists found African skulls with trepanation, a medical procedure where a hole was carefully opened in the skull to treat head injuries or pressure. And many patients survived. Ancient Egypt, part of Africa, had medical papyrus documents describing surgery, wound treatment, bone setting, dentistry. African medicine was not only spiritual, it was scientific. African medicine treated the whole person, body, mind, spirit. Illness was sometimes physical, sometimes emotional, sometimes spiritual. Healing rituals used herbs, smoke cleansing, prayers, ancestral guidance. Divination tools like cowries or Ifa trays helped understand deeper causes of illness, stress, fear, trauma, or imbalance. This was holistic healthcare. Women were central to African medicine. They were midwives, herbal experts, caregivers. They managed childbirth, fertility, breastfeeding, and child health. African midwives delivered babies safely long before modern hospitals. They knew pain relief herbs, birthing positions, and post-birth care. Without women, African medicine would not exist. Mental health was never ignored in Africa. Depression, grief, and stress were treated through counseling by elders, community support, music and drumming. Group rituals. Healing was communal, not isolated. No one suffered alone. Drums, stories, and gatherings helped restore balance and peace. African medicine was passed orally, from elder to child, master to apprentice. No books, no papers. Yet the knowledge survived for centuries because it was practiced daily. Mistakes were corrected. Results were observed. This was living knowledge. Colonialism disrupted African medicine. Traditional healing was labeled primitive. Western systems replaced local knowledge. Many practices were banned or destroyed, but African medicine never disappeared. It survived quietly in villages, homes, and forests. Today, African medicine is returning. Herbal markets thrive. Traditional healers still practice. Modern science now confirms what Africa always knew. African medicine is not the past. It is a living legacy, respected, protected, And remember, it healed Africa long before colonialism. If you want more real African history, not watered down, not rewritten, subscribe and stay with us.